Okay, so in today's video, I'm going to be doing a lesson here on healthcare.gov, which, if you don't know, it is the website for the Affordable Care Act that many call Obamacare. But before I get into it, I wanted to address a few things. Uh, since I found my copy of the Constitution, I found it in the back of one of my old student dictionaries. I've had it for many years. Let's see, what year did we get this here? 2005 is when we got this student dictionary. So I've had this for many years, and I knew I had a copy of the Constitution. I just couldn't remember where it was. But the reason why I mentioned the Constitution, because when we go and we talk about this, there has to be recognized that in the United States Constitution, under Article 1, which gives power to the legislative branch and the House of Representatives and the Senate, it talks a great deal about the Senate's and the House's rights to create taxation. And this is where we get the cause for when we have the Bill of Rights, which is going to be the First Amendment, which is after Article 7. No, Article 7. Is it Article 7? You're right. Let's see. It is after the first Article 7. We get the amendments which start after Article 7, and then Article 1, which is the First Amendment, starts after the original Article 7. But this is where we get the cause of no taxation without representation. It is against federal law for Congress or the executive power to pass any tax without representation and plausible cause. So keep that in mind when we look at the Affordable Care Act and what the individual mandate, which is what they call it, versus what we actually call it in the marketplace, which is the shared responsibility penalty. And just keep that in mind when we talk about it. But I'm going to first address that under normal circumstances, this would be considered illegal for my former colleagues at the marketplace. But as a private citizen, and for the fact that this video will not violate any HIPAA law, but rather utilize the tools that we have access to universally with the healthcare.gov website to show you what happens when government monopolizes and takes control over things and forces you through taxation without representation to purchase a plan. When government begins to monopolize and reject the free market solution, which is listed in our Constitution, this is what happens. So, but first, because I know there are some people who are worried about the future of healthcare.gov and of Obamacare, this is what you will always hear from the marketplace. The court's decision does not affect 2019 enrollment for coverage. The court's decisions will not close down Obamacare. The court's decisions will not rescind Obamacare. The only thing that the court's decisions will determine is whether it is legal under the Constitution for Obamacare to continue to force you, the citizen, through taxation to purchase something, which is, as we've already discussed, considered taxation without representation and is against the Constitution of America. That is why the Obamacare was recently, without the individual mandate having been removed in this new tax bill that has just passed, which won't take effect until this year. Once government reopens and all that, then you'll start to see the new tax cuts take effect. Then it was determined to be unconstitutional without the individual mandate or the tax. And so now the Supreme Court has to use the powers invited by the Supreme Court to determine whether or not it is constitutional according to the Constitution and its original intent or translation. Now, this is the first, before I get into showing you the plans and what the cost of the Affordable Care Act is, there are a few things that you have to bear in mind when you're dealing with the Affordable Care Act. You have to bear in mind what it is. We have resources on healthcare.gov that will tell you what the Affordable Care Act is, but I want to click on it and show you the information so that you can be aware of what you can learn about the Affordable Care Act versus what the people who sell the Affordable Care Act already know about it. But this is the one right here that you should click on if you want to learn more about the Affordable Care Act. It's about the ACA. And this part right here, is all you really need to know about the ACA. Regulations and guidance. But I want to look here because regulations and guidance about the ACA, when we actually click on it, you'll see what I mean. But this part here is going to be used. It's going to be somewhat similar to this. But I'm going to click here on the Affordable Care Act and pull it up. This is a easier version of it. If it pulls up, let me see. This is the one that I'm looking for. If it would go a little bit faster, we can get this done quickly. So what we're going to do is we're going to go down here. Now, why do they have to write it in italics? And they have a really poor. Right there, we want to go to section 3. Right here. Right there, subarticle B. So this is where we want to go. Right here. Section 704. Subpart 1, General Reform. This is the part here that you want to go to, and then the provisions are good too. But this is all that you really need to know in regards to how the Affordable Care Act what it means to you and when it talks about cost and cost effectiveness. So I'm going to go down there, and I have to move down slowly because I don't want to pass it up. It would be wonderful if it was an interactive table of contents where you could just click on it, but they didn't think that way. They don't want to make it easy for you. It's much easier for people who actually work doing it because we get to see it in its detail much easier. Hoping that I'm not passing it up. Here it is, general. Did I pass it up? That's Medicare. No, I think I was looking at the wrong one. That's Medicare. Just go down this way. It's hard for me to see. Another thing about Medicare and Medicaid, they're the ones who issue the Affordable Care Act. And that's also the reason why for people who are older, who are on Medicare, that's the reason why there have been cuts to Medicare. Medicare it's not cut per se, but half of the spending has been repurposed and reallocated for the Affordable Care Act. There have been no cuts, but you don't receive the same level of care and comfort you used to before because it's now been repurposed and reallocated to include the Affordable Care Act. Because by the law, insurance companies now have to forego everything toward the Affordable Care Act. So when you call them, they mention things about the Affordable Care Act. And so that causes a disparity amongst Medicare because it also increases the insurance prices for Medicare and Medicare supplemental plans because it increases them across the board. It's a non-discriminatory plan that increases prices across the board, and you'll see why when we finally get to that section. This is still Medicare. I don't care about Medicare. Go down here. Does this say what page it's going to be on? Let me go back up here to the table of contents and see what page that's going to be on. What? Could have sworn I was here. Because I'm tired of looking. This is horrible. This is horrible. It shouldn't be this difficult to find this section that I'm looking for. I'm looking for section 2740, but they got them all out of order, so it doesn't matter anyway. Let me go back and see if I click on this one, if it will be more concise. It doesn't look like it. Looks like it's going to be just as long. I might just have to focus on it in that one little area and blow up the zoom option so that we can actually see it. Okay, this one's much better. This one is much better. It tells me exactly what page to go to. Right here, this is going to be really important. Right here, we'll go to page 58 through 68, which is going to be really important. This right here. Alright, here we go. I got it all right here. Health insurance market reforms. Starting right here at 1201. We'll go to page 45 and we'll get started looking at it. And we'll look at it for a little while. So I'm going to go down to page 45, which will be made easy by, let me move this out of the way. Can I, no, I didn't download it, so I'm going to go right here, 45. Let me see. Did I do it right? That's the appeal process. I don't care about the appeal process, which is a whole nother thing on its own. Let's see, what page is this? .44. Here we go. Right here. These are the things that are required under the health reform law to be included in all plans, regardless of gender, sex, age, or pre-existing condition. These are required to be put in all plans. So the first thing that you'll notice is pediatric care, which is the care for a child or any beneficiary that is under the legal age of an adult. You are required, according to the Affordable Care Act, to purchase children's health care. Even if you have no children, it will still be included in your health plan and still be included in the cost of your health plan, even if you have no children. Then here, direct access. This one's pretty good. And I want to say this one's pretty good. This particular plan, direct access, if you look at it here, is a group plan or health insurance offer for individual health insurance and coverage described in paragraph 2. Now, this one's really good, but it sucks for men because this one talks about women's care. So this is where I said that the Affordable Care Act messes up a lot of things because according to this, now all health plans have to include 100% women's coverage options, regardless of whether you select the male option or female option on your health insurance plan. So your prices are jacked up again because you have to pay for women's care. Now, I want to talk about the disparity in insurance prices for just a moment. Health insurance has always been the only insurance plan that women have paid more for. And that is because women go to the doctor more often than men do. For whatever purposes, they go for gynecology checkups and things like that. And men typically don't start going to the doctor until about the age of 40, when they have to start taking their annual prostate exams and physicals and colon checks and things like that. And even then, it's usually because their wives or daughters and sisters force them to go to the doctor. Men typically don't like to go to the doctor. But men pay more for life insurance because men die earlier. So they're expected to use it more often. So they pay more for life insurance on average than women do. Men pay more for car insurance on average than women do because more men drive than women do, and more men are expected to get into car crashes and partake in high risk situations than women are. So they pay more on average in car insurance than women do. The same thing for dental insurance. On average, it used to be men paid more for dental insurance than women did because of stupid things. Let's say, for instance, lots of men are there are more men in like sports careers and fighting careers where they have to get a lot of teeth work in, so the dental prices were higher for men than they were for women. So this disparity that says that women have pay more, and they do pay more, and they have to pay more because they use it more. That's how insurance prices work. But they don't tell you that on the networks and on social media where they're trying to paint this oppression against women. But this is a good thing for women, but it's a horrible thing for everyone else. Especially, say for instance, if you have some women who reach a certain age and decide to get a hysterectomy or something like that and get rid of some of those ailments that they would have to go to the doctor more exclusively for, and then those hysterectomies and things would reduce the price that they have to pay because they wouldn't go to the doctor nearly as often. But we'll talk about prices more when we actually look at the plan, and I'll come back to that and mention it in a moment too. But I'm going to keep scrolling down here, and now we've just seen this part when it talks about women's care. It has to be included, 100%. Has to be included in all health plans. Now, if you go down here, you'll see health insurance consumer information. Now, this part right here. The criteria. Now, no plan is allowed to deny you for any coverage, which is a good thing. That's a good thing. No plan is allowed to deny you if you have a pre-existing condition. No plan is allowed to deny you if you gain a pre-existing condition. And no plan is allowed to reject you because of that. But you take a look here at the criteria, and we're going to read it. This is the part that I want to read. But see, this is about educating the consumer, but the part that I want to read is on the next page. Because this is the parts that are most important. No, this one isn't it either. This one's talking about the money, which we'll talk about that later. Now, the table of contents had it so much easier looking than the way they actually have it written here. You know what? You know what I think it is? I think it's because I went to page 45 here instead of page 45 here. Let me go. I think that's exactly what it was. So let me go down a few pegs. Yep, here it is. This is what I want right here. Now, this is the general reform rule. This is the big thing. This is what makes up the bulk of the concerns and cases about the Affordable Care Act. This is the big stuff. So I want you to, if you want to look at it on your own, it's page 45 according to this, page 64 according to this. But I'm going to say the same things that we just read about, but right here is the first thing. It's the fair insurance premiums. It prohibits discriminatory premium rates. What this means is it is saying what I just mentioned about the differences in pay rates versus women versus men, but this isn't only a women-men thing. Look here. Tobacco usage. That's considered. Age is not considered anymore. You know, young people used to pay less for health insurance than older people did because we use it less. But now, age, you don't need to pay less for being younger anymore. Smokers, you still have to pay more if you're a smoker. That's the only thing that hasn't changed. You have to pay more if you are a smoker. And you can't lie and say that you aren't a smoker, because if you go to the doctor and they determine that you're a smoker, they report it back to your insurance company and they adjust the cost of your plan without your consent because they found out that you were a smoker. So you can't lie about it. And so it says whether the plan covers an individual or a family. So you have to pay the same rate for one person as you would if you were a family person. And I'll get to that in a moment too, because we're going to look at the plans. This part is really just the meat, but we're going to look at it in great detail and example when we actually go and look at some plans. Now, right here, you see here. Actually, I think we can go to the next page because we've talked about the rules and relationships to what it has to include, or the discriminatory thing. Now, here's the guaranteed renewability of coverage, which gives the marketplace the rights to renew your coverage with or without your consent. Now, this part, it's pretty bad because you're not guaranteed to get the same plan that you enrolled in the previous year. What the marketplace does is they'll take plans and they'll take a look at the plan that you have picked, the cost of your plan, the deductible of your plan, and they will try to, if it is available the next year, they will try to enroll you in that plan. If it's not available, they will enroll you in one similar in cost, but not similar when it comes to your doctor choices, when it comes to your hospital choices, and in many cases, when there's only one other plan available, it will just be the next cheapest plan available that is in the silver or bronze category, depending on what category of plan you pay for. And we'll talk about those when we get to prices too. But this isn't really good for you because your price goes up every year when they automatically renew you. It's not like you're getting renewed at the same price. Say for instance, if you purchase a life insurance plan and you purchase a plan that automatically renews every year, you've locked that plan in for 15 years. You have the same guaranteed price for 15 years. That won't change. But with this, you're allowing them to automatically re-enroll you for the next 5 years, and your plan's price will change from year to year. It's not like you're locking it in. That's something that you need to understand about that too. Now we're going to move down to the next section, which is about, this is right here, which was about what I just mentioned earlier about pre-existing conditions. It's good for people with pre-existing conditions, but you know what? That tags on to the cost again because it's non-discriminatory against people with pre-existing conditions. So in order to compensate for that, people with pre-existing conditions, the prices that they are charged to everyone, regardless of whether you have pre-existing conditions or not. The only thing that is an exception to the rule is tobacco usage. The only thing. That's the only thing that will increase the rate of your insurance plan above everyone else's rates is if you're a tobacco smoker, which about 50% of the United States population is a tobacco smoker, so we'll look into those prices. The wellness program thing was a good idea, but it was never implemented properly by the Affordable Care Act. And for people who get these benefits to their jobs with health flexible savings accounts and FlexFax and Flex cards, the wellness programs or medical reimbursement programs that allow you to be able to do daily activities that make you healthier, and you get reimbursed medically for taking certain physicals and going to the doctor and doing certain things. What it's trying to do is it's trying to incentivize you to purchase health insurance and go to the doctor more often to receive medical reimbursements, and then use that FlexFax card to pay for your medical procedures that you go to, which doesn't actually work very well, and then we'll look at the reason why it doesn't work very well when we get to the plans. But I want you to keep that in mind, that the health savings accounts are a wonderful idea, but they weren't implemented correctly. And that's something that we should try to get Congress to focus on, and I believe that was something that they considered for the repeal and replacement of Obamacare was flexible health savings accounts. But again, we have to write our Congress peoples and try to get them to do something with HSAs, or medical reimbursement accounts. But we're going to move down to the next page. This one talks about existing programs. If you are enrolled in a plan, it is not supposed to arbitrarily increase your prices. But this only accounts for during the year, and it does not account for if you lied and said that you were not a smoker. It doesn't account for going into the new year. So what it's saying is, for example, if you buy a plan that's $10 and next month it jumps up to $20, that's supposed to be prohibited by the law. And in many cases, it's not followed because it happens far too often. And there are reasons why that happens, and I'll go into that reason when we actually go look at some of the plans. So we just talked about we've already talked about the non-discriminatory healthcare option earlier. This is the comprehensive health insurance coverage. I pushed the wrong button. We're right there. This is what they consider essential healthcare. This is important because I mentioned that young people used to pay less money for health insurance than older people, and that was because young people would be able to get plans called catastrophic plans. Now, catastrophic plans are not considered essential health coverage under the Affordable Care Act because of what they've broken down here. In order for something to be considered a essential health package, as an insurance provider that offers health insurance coverage in individual small market groups that shall insure and coverage and include essential benefits packages. According to the essential benefits package, which we will get down to right here, it's going to tell you all the general stuff about what makes a plan essential. Child-only plans are essential. Dental-only plans for children are essential. So when you get a plan, children are always a part of it, and children's dental is always a part of that plan. Children's vision is always a part of that plan. Children's coverage is always considered essential coverage, regardless of if you even have kids. The cost sharing, which is really important too, we'll get to that when we get to the prices, but I don't want to touch on it right now because you have to see it to understand it more. But what the essential health packages says is that if you don't purchase a full insurance plan, then it does not qualify for as comprehensive health insurance or essential health benefits. So no more could you pay for the catastrophic plan, which is no longer cheap anymore because you don't receive any federal assistance with catastrophic plans at all, and so you can't buy them anymore because the law says that they're not essential, and they don't even compensate you to help you purchase the plans, so you can't buy it anyway because of how expensive it is. But you have prohibition of excessive waiting periods, which is a good idea, but again, it is never used by the Affordable Care Act or their plans. We saw that with the cases of the VA who were on a long waiting list, and several of them died in that waiting list. About 200 of them died in that waiting list. And many people are forced to wait excessive periods of time because of backlogs, because of plan choices. And we'll talk about that in a moment too, about doctors' choices with the plans and hospitals' choices with the plans. This is a good idea, but it is not implemented in the actual Affordable Care Act. People are forced to wait excessive periods of time, and there's nothing done about it. Coverage for individuals participating in approved clinical trials. That's a good idea, but it's only for people who are being guinea pigs, so to speak, who are doing, they're going to the doctor for to test out this new medication, to test out what the new effects that it has on this and that. And it's really good. It's really good for those people that do that. But again, you get paid to do that. You don't need health coverage to do that. You get paid to do that. So it's a good idea, but it's a worthless idea because you're actually getting paid to do that in most cases. This still talks about the clinical trials things and lets you know about your rights with clinical trials. Here's the other provisions. This is the one I talked about, the preservation to maintain existing coverage, which means that if you want to keep your plan, you can keep your plan, which we already talked about is a lie, because your plan can change every year without your permission, with or without your permission. And your plan can even change during the year if you lose your tax benefits because it'll change to a lower plan. And we'll talk about that when we actually look at the plans too. But the application of these provisions are supposed to be so that you never lose your doctor, so that you never lose the hospital that you want to, and so that you never have to worry about losing your plan. But I'm going to move down to this one. This is the next one. Rating reforms must apply uniformly to all health insurers and group plans. This is what makes the plans more expensive because it says that all of the health pricing, ratings means pricings, have to be applied to all plans. It is a standardized rate for everyone, regardless of age, sex, medical history, with the only exception being tobacco usage. It raises the prices for everyone while eliminating the need for competition and competitive prices. Annual reports are on self-insured plans. It talks about that in great detail. That's not really something that you talk about too much. Self-insured plans are for employers. It forces employers to purchase health insurance plans for their employees at these high prices, and many employers can forego that force by only offering health insurance to full-time employees, and that's what they do because it's too expensive for an employer to have to pay for coverage that doesn't do anything. And now we're going to move down. This talks about the effective dates when everything gets effective. This is the available choices, the established qualified health plans. So this is what tells you that catastrophic plans are not considered essential coverage. This is what they consider essential coverage. A plan to be considered essential coverage has to have ambulatory service, hospital services, hospitalization, emergency services, maternity and newborn care. Men, you don't have women's reproductive organs, but you have to pay for maternity and newborn care regardless. Mental health care and substance abuse, you have to pay for that even if you don't use mental health or drugs or anything like that. Prescription drugs, which is good. Rehabilitative services, which is good, but again, it is worthless for people who don't need rehabilitative services. Laboratory services, which is good. Preventative and wellness services for chronic disease management, that's a good one. Pediatric services, which is for kids, including oral and vision. You have to pay for that, even if you have no children. These things have contributed to the massive raises in the prices, and every plan has to include all of these to be considered essential, to be considered something that you can purchase without being taxed. That's why the catastrophic plans no longer work. And I'm going to go ahead and move over to the plan's cost now, because now that's where we can start talking about it. So if you are on healthcare.gov, this is how you can see what your plans look like. you can see if I can enroll or see if I can change. That will be an easy way to do it, but I'm going to show you a much easier way to do it. You just go up here to healthcare.gov/C-plans. What this does is it takes you to this website, which allows you to look at the prices of plans before you choose to purchase it. Now, there are many different plans across the thing, but I'm going to use Mississippi as an example since most of the people who will watch this video are from Mississippi. I'm going to show you what Mississippi has available. Let's go ahead and type in a zip code for a Mississippi zip code. This is the cheaper county, by the way. Forest County is a cheaper county than Lamar County. And let's say no. Well, you can actually skip it, but we're just going to say no. And we're going to do this just for you. And let's say we're going to close that out. We're male, and I'm not 25, but I'm going to put 25 in there, and we're going to go continue. Now, let's say, for instance, that you make $10,000 a year, because remember, the Affordable Care Act was meant to help the people who don't make enough money to buy insurance. You make $10,000 a year because you're on hard times. Let's take a look at what you qualify to get help with. This is what you receive. You don't appear to be eligible to receive a tax credit. So when you actually apply for coverage, it will flat out tell you that you aren't eligible for coverage for the Affordable Care Act. But so you go and you want to go buy a plan anyway. So this is what your plans will actually look like in the state of Mississippi. This is what your prices will look like. And you can just close that, or you can hit next. It just tells you how to do search options. But this is what your plans will look like. You have your bronze plans, which are horrible, and I'm going to click on one to show you why your bronze plans are horrible. You have your silver plans, which are horrible if you don't receive tax credits, but they're still horrible if you receive the tax credits if you don't receive the cost sharing reductions, which we'll talk about that when I click on the silver plans. And then you have your gold plans, which are horrible because of the cost. There's no incentive to buy the gold plan because you don't receive cost shares on gold plans, only silver plans. So I'm going to click on the bronze plan real quick. Let's go to details. So Mississippi, we have good prices here. Just go a few hours to either direction, Alabama or Louisiana, you'll see prices jump up to $800 a month for the cheapest plan. And I could show you that, and if I got a zip code for Louisiana, where Louisiana Blue is the biggest insurance provider. But I want you to notice this. Keep this name in mind, and better, for Magnolia Health. But let's talk about what this plan includes. Your plan has a $380 monthly premium, a $6,550 deductible, and a $6,550 out-of-pocket maximum. This is a good thing. You always want a plan that has an out-of-pocket maximum that equals your deductible, because when you reach one, you reach the other and get free healthcare for the year. But a $6,000 deductible you will never meet at my age, at the age of 25. Well, I'm not 25, but the age we have listed here. You will never meet this deductible unless you get into a massive car crash or something that is massively unfortunate. This is where everything matters. your co-payments and co-insurances. If you go there, you'll see that no charge after the deductible. What this means is, until you meet this deductible, every time you go to the doctor, you pay full price for this, full price for this, full price for that, full price for that. Scroll down, you pay full price for emergency rooms, full price for inpatient hospital stays, full price for prescription drugs, x-rays, routine eye exams are not covered for adults. They are covered for children, and there's no charge for children regardless of deductible. And no dental care for adults, but it is covered for children. Then this is where you look at things more and things. You have no coverage if you go to a doctor that's not in your network, but you still have to pay the full price regardless. You have the same thing for specialization visits, for x-ray visits, for laboratories, outpatient facilities, outpatient professional services, hearing aids for elders aren't covered, routine eye exams for adults aren't covered, children's services are covered, no charge, regardless of deductible, but only if it's in the network. If it's out of the network, screw you kids. We don't care about them anymore. Eyeglasses for children are no charge after the deductible. But again, if you go to a doctor that's not in your network, which good luck looking for one that's in your network because you can't really find one. You are eligible for a health savings account that you will never use. This is what I wanted to talk about with the health savings accounts. You will never use the health savings account with a deductible of more than $6,000 because every time you go to the doctor, you are going there to try to get medical reimbursements to use your health savings account so that you don't have to worry about paying the massive deductible. But you can't get those health savings accounts if you don't pay the doctor because they have to be the ones to write the report to send to the health insurance company, to send off to your job or wherever you get your health savings accounts from in order for you to even begin to get the money deposited to your health savings account. Then you go down to drugs, generic drugs. You know, this is a really big thing with 1 in 3 Americans on some type of medical drug, and you have to pay full price for drugs no matter what until you meet that massive deductible. Take a look here. You could see the list of drugs that are covered. Most drugs you have a trouble getting, so you have to go to the generic or preferred brand, and sometimes you need specialty drugs, and some doctors and some insurance companies don't even cover those drugs. And you have to be very careful when you want a doctor, because even if the insurance plan says that they have the doctor, if the doctor says that they don't accept the insurance plan, the doctor's not going to take the insurance plan, or the hospital's not going to take the insurance plan, and you have to pay full price anyway. Look at this. This is what you actually buy. You have to pay for all of this every time until you, through some stroke of miracle, pay the $6,550 in order to use this plan. You have to pay out of pocket for everything. Take a look at this silver plan. It's a little bit better, but what did I just say? You want a plan that has a deductible that meets the out-of-pocket maximum, because you won't be left with things like this. And I'm going to go on down to it. Look at our prices. It's a better plan, but not by much, because this is where it gets costly. Even if you meet the $6,000 deductible, you'll still have to pay 40% of the emergency room until you meet $7,900. For each one of these things that say after deductible, you have to still pay until you meet the $7,900. And until you meet the $7,900, you will still pay co-pays of $50 for preferred brand drugs, $30 for doctor visits, $60 for specialist visits, You will still pay the $30 for laboratory visits. You'll still pay the same copays until you meet the $7,900 out-of-pocket maximum, which reduces your prices down to zero when you get that out-of-pocket maximum. You're still going to pay all of these. In addition to now, you don't have to pay the full price anymore, but you still have to pay 40% of the coverage. And think, some of these specialty drugs can cost $1,000 a pill, and you have to pay 40% of that cost every time. Why would you choose to get a plan like that, where you can't use it? And you're 24, 25 years old. This is what you have to pay for. And remember I said take a look at Ambetter? Notice that there's only 5 plans to pick from. They're all Ambetter. They're all going to have the same doctors in the network. And they're all going to offer you practically the same thing. You have no other choice, no other option to pick from than Ambetter. You have no other choice but to pick this plan, because there is no other plan available in the network, because the government's monopolized healthcare have eliminated competition, and the companies that you want have left your area. But so let's say you aren't poor, you're not poor, you're still 25 years old, but you're part of the middle class. You make $40,000 a year. That's part of the middle class. This is how much assistance you're going to receive. You only get $107. You have no kids, but your prices still look like this. You get a little cheaper for your health insurance every month, but you still have to pay the same things, same deductibles, same everything. So if you're poor, you can't afford it. If you're wealthy, you can't afford it. And let's say you're part of the upper class. You make more than $50,000 a year, which is what they consider to be part of the upper class, which isn't actually what economists consider. But let's say you make $50,000 a year and you have no children, you're just one person. Now you don't qualify to receive anything anymore. You have to pay the same price as you were if you were poor. Pay for the full thing. You got to pay the same price as before. So what income level do you have to be at to receive something good? 20,000. You have to be borderline poverty to receive anything that will make your insurance plan. Give me a second. Hello? I'm doing the video right now. All right, I'll come over there. I'm almost done. All right. But so you have to be on borderline poverty, $20,000 a year. You have just to be able to receive help to pay off your plan. And now that bronze plan is $20 a month, but the deductible doesn't change. But what changes here with the silver plans? This is what we call the cost sharing reduction, which you can only get if you meet a certain price range. Notice you didn't get the cost sharing reduction at $40,000. You won't get the cost sharing reduction at $30,000. You have to get the cost sharing reduction if you make less than $29,000 but make more than $17,000. And that cost sharing reduction reduces the deductibles and out-of-pocket maximums and your co-pays on silver category plans only. This makes the silver plans so much more incentivized than to get a gold plan, which used to be the top of the line plan and used to be before the Affordable Care Act had an average price in Mississippi of something like this, or something like $300 as opposed to 500 what it's worth for now. So if you're poor, you're forced to lie about your income so you can get this. This is what you want. You want this and you want this. If you make too much money, you're forced to lie and say that you make too little money so that you can get this. But when you lie about those so that you can get these added benefits of being able to get things at a cheaper price, notice that the deductible is no longer included, but you still have to pay the 40%, which is okay. But you don't have to worry about paying a deductible because your deductible has been reduced to $0. And you've got a tax credit that is applied every month, with a cost reduction that is applied every month. But you get these prices, and you are fortunate to be able to get it, but you have to lie in many cases to receive it. And I'll show you the reason why I say that, because I'm going to change this person's income again. It's 25. I want to change the income. We have 15,000. Now we can qualify for more cost sharing reductions. You're incentivized to lie some more, because now you get a deductible that's still $0, and you get more cost sharing reductions. Cost sharing reductions come in different packages, depending on what your income is in comparison to your household. Okay, so you get this. But what happens when you smoke? Let's look at what the prices look like when you're a smoker. I'm going to go back here to household. Look at what happens. You'll get the same tax credit allocation. Same thing. We have the same tax credit allocation, but let's look at what happens to your prices. They get more expensive. Look at that, the base price right there. Remember when it was $380? Now it's jumped up to $437 a month, and it even gets more expensive on this category where you were paying $80. Now you gotta pay $90, $100. But what happens when you have two people? You edit your household again. You're not single anymore. Go back to household, blah, blah, blah. Edit household. You and other people. You're not single anymore, but you have one child. But times are tough, and only one of you is working. And that one person who's working is a tobacco user, and you have a child under the age of 19. You've got your wife. She's the same age as you are, maybe younger, and she doesn't smoke. But let's say she's pregnant with another child. And you're dependent. Well, I don't know. I don't know how old they are. Let's just say they're 8 years old. You started way too early. You got a little son, 8 years old, and you continue, and your income level, we'll give them 18,000. Look and watch what happens. You don't qualify for anything. Your husband, who's working, can't get the tax credit, Your wife can't get coverage, so she gets sent over to Medicaid, and your kid is said that they may be eligible for Medicaid, and they get sent over to Medicaid, and they're in a waiting list over there for about 3 months before you get any information as to whether or not they can receive the Medicaid or not. And then, if they can't, you amend your plan and come back, and you have to deal with this. This is the price just for your husband. That's the price just for him. Just for him. This is him alone. Watch what happens when your wife's not pregnant. She no longer qualifies for the Medicaid. Your kid will still qualify for the Medicaid because they're a kid. But your wife no longer qualifies. So now you both don't receive a tax credit. Take a look at what your prices look like now. Look at the deductible. $13,100 deductible for a family of two. Family of three, technically, but a family of two. They got to spend the cheapest plan that you can spend. $818 a month. $13,000 deductible that you will never meet to use any of these co-payments. How many people can afford $800 a month on insurance? You can't. You won't. To get the plan that's good for you, you got to spend $1,000 a month to use it. This plan's the one that you want, but you can't get it. It has the cheapest deductible, the cheapest out-of-pocket cost for the year, and the best co-pays because of the deductible being so cheap. But you can't get this plan because you have to contribute $12,000 a year to get this plan, and you only make $18,000 a year. Your family household only makes $18,000 a year because your wife's not working and your job pays you $18,000 a year. So you have to figure out whether or not you want to spend $10,000 a year for coverage or $12,000 a year for coverage, or for deductible and out-of-pocket costs that you will never meet, that you will never use, and in many cases for an insurance plan that you will never use unless your wife's pregnant or unless you get into a bad accident. And notice there are no other options for you to pick from. I also wanted to make sure that I mentioned that, because I didn't mention it when I was going over before, that when I scrolled down here, I wanted you to notice that when I was scrolling down here, I didn't talk about a lot of things I scrolled down here. But if you look down through these other services, you'll see weight loss programs, asthma, diabetes, low blood pressure, things like that. You'll begin to see the typical cost for women's services. You'll see all of those things included in your plan's brochure. But this is the price if only your husband smokes. What happens if both of you smoke and have the same income? This is what becomes of that price tag if both of you smoke at the same income level. Take a look. We're from 818 to 875. You went from 900 to 1,000. What about that one that was 1,000? You jumped up from 1,019 to almost $1,200 a month. You know that's more money than you make a year to buy this plan, the plan that will benefit you and your wife. 1,200 times 12 is $2,400, or 24,000, should I say. You know you can't afford to buy the plan that is best for you and your family. And this is supposed to be the Affordable Care Act, affordable insurance. That's what it's supposed to be. And you can't afford to purchase any of it for your family. But this is if both of you smoke. And think of how many people smoke each year. Think of how many people are dealing with this circumstance right now. So the fact that now they have to lie about their income. So this is what happens. They tell a lie about their income and say they make 30,000 when they only make 18. They get the coverage that they want. They get the tax credit to reduce their prices. They get it because they lie and they reduce their prices down to something that they can afford. But you know what happens when you lie about about how much money you make? It comes back and it bites you in the butt, and it bites you in the butt very hard, because the tax credit allocations that you get are based upon your income level and your household size. So if you lie about your income, when it's time to file taxes and reconcile the premium tax credits that you will get going into the next year, the IRS takes all of that. They take all of the money that you weren't supposed to get, and you lose your entire tax refund because you were trying to do what's best for you and your family. This is what happens when you let government take control over all of your prices. When government takes control and monopolizes your systems, this is the cost of this. This is the cost of free. When they tell you they want you to have single payer health care, when they tell you that they want you to have universal wages, this is the cost of free. The rest of the prices raise up in order for them to still make money. You know who's paying the rest of this bill? The common taxpayer. They're paying the rest of the $800 that this family has to pay for the $99 that they have to pay now. The taxpayer is the one who foots the $13,000 deductible bill. That's what happens when you ask for free. The prices of everything regarding that quote unquote free becomes unaffordable. But that's all I wanted to talk about with the Affordable Care Act. I wanted you to see what the prices are and make you understand it a little bit more. Go on here and experiment and see exactly for yourself in your own states, in your own areas, what your prices are. Hope you learned something. Have a nice day.